All right, it's a frightening statistic, but 1 in 2 men, about 1 in 3 women at some point in their life will receive the diagnosis that they have cancer of some form or another. And the first thing you want really is information. As you know, we've shared my story before with prostate cancer. But the key might be what happens long before you get that diagnosis, and folks just are not getting the message about that. So to help get that word out here this morning, my good friend Dr. Jean Swan joins us once again this morning, and Dr. Leigh Erin Connealy, an MD who joined us down here from Orange County today because the Cure to Cancer Summit starts tomorrow online, a totally free event, Jean.
Yes, Mark. Tomorrow, September 3rd, people can sign up at theCureToCancerSummit.com and hear 30 free interviews with medical doctors, naturopaths, holistic practitioners, nutrition experts, cancer survivors, a whole global gathering of experts and people who have been through cancer or treated cancer, as Dr. Connealy has, and they have solutions that most people are not aware of. Most people are diagnosed, they don't know what to do, they're very limited in their knowledge of what's available, and we bring all of these possibilities to them so they can consider them if they're suffering from cancer, if the loved one is, or if they want to follow this information and stay healthy and avoid degenerative disease.
And doctor, this is the comment that you made to me when you came in. We talked about all these different alternative therapies and how they are integrated now into more traditional Western medicine, and yet you said the cure really is prevention. Well, what's the disconnect? What's the word that people aren't getting that they might begin to get if they join the Cure to Cancer Summit online?
Well, first of all, people just are lacking the knowledge they need, like you said. There's just not the availability. The conventional treatment is surgery, chemo, or radiation, or some combination thereof. And I tell patients that's just the first 3 steps of 100 that you need to know about. And so we want to create, the Cure to Cancer is creating this amazing educational forum and empowerment series that you're going to learn so many things, not just about doctoring, but how to eat, how to detox, how to emotionally resolve issues.
We hear all these things separately in bits and pieces, Jean, and you and I have talked about this before, that stress can help exacerbate or even cause cancer, bad nutrition, but all these things taken together, that they're never really brought together in an integrated way that people can look at a total lifestyle. That's what you're trying to do with the Cure to Cancer Summit.
Yes, Mark. It's in Western medicine, it's very compartmentalized. The idea of the emotions and the nutrition aren't necessarily brought together in treatment for people. But that is available through integrative doctors such as Dr. Connealy and other health experts that we bring to the public for free. You can get a lot of information. You can do a lot of things for your health and integrate them, because we do need to pay attention to our emotions, our stress level. We hear this over and over again. How do you do it? What do you do? Listen to our experts. You'll find out.
Yeah, it's not enough just to say, hey, calm down, Mark.
Right.
You know, I mean, how?
Exactly.
People want to know how. Doctor, what do you think maybe is one of the more exciting things to come out of research and this integrative approach here in the last 10 to 15 years even?
Well, first of all, what's on everyone's mind is, do I have cancer? Cancer, from one cancer cell to a tumor, is 10 years. We know right now how to detect cancer at year 1, 2, or 3, or 5, and nobody knows about it.
Long before the tumors show up.
Long before the tumor's shown up on a scan, a mammogram, a colonoscopy, or a PET scan. So people have the opportunity to completely prevent cancer today, 2014. And that's sad that everyone doesn't know about it.
Why do you suppose that is? Is it just I'll just share my experience. And again, I have known this. My family, has been involved with some of these alternative therapies going back to my grandmother, who was one of Dr. Contreras' patients down at the clinic down in Mexico that we've talked about before. And yet, when I got the diagnosis, I folded like a wet paper bag. The doctor said, I suggest you do surgery. I suggest you have the tumor removed. You're a very young man. Once it's removed, then you won't have to deal with it anymore, and it'll be done. But there's side effects to that surgery. I didn't even consider that. I said, take it out.
Also, that's a fallacy, too. The tumor is a symptom of a whole body problem. And so you can take out the tumor, but if you don't deal with the whole person, body, mind, and spirit, you're not going to eradicate the disease.
And I love my doctor, don't get me wrong. He's an expert at what he does, highly competent. I felt like I was in great hands. But again, these other things weren't discussed because I'm guessing that wasn't taught to him in med school.
Right. Well, there's something called circulating tumor cells and stem cells. They're responsible for 95% of metastasis and death. And that is the scary part. You want to know if you've been given a diagnosis and you've undergone treatment. Now, how do I ever prevent a reoccurrence?
Okay, so these are just some of the really, really important issues that they're going to discuss on the Cure to Cancer Summit. Jean, again, tell folks how they can get involved. Again, it's totally free. You just want to get information out there, and it starts tomorrow.
Yes, it starts tomorrow at the curettocancersummit.com. Sign in your email name. You'll receive immediate access to 2 interviews per day starting tomorrow. And you will also receive a free complimentary copy of our Integrated Health magazine. We'll have experts like Dr. Bernie Siegel, a mind, body, spirit expert for decades, a leader in this field. Also Dr. Gabriel Cousins. We'll have Jeffrey Smith, the world's leading expert on GMOs, talking about the hidden dangers in our food supply, the toxins we need to avoid. Everybody needs to pay attention to this information. We can't afford to be passive about our health anymore, and I hope everyone joins us.
All right, Dr. Jean Swan, Dr. Connealy, thank you so much for being here this morning, for sharing this, and doing it absolutely for free at the Cure to Cancer Summit. So
thank you so much, Mark.
Thanks for coming, and thanks for making the trip for us.